This morning we're joining Dr. Shoemaker with Shoemaker OB/GYN at Thomas Hospital to talk about prolapse and incontinence. And first, Dr. Shoemaker, let's talk about prolapse. If you would, please explain what prolapse is and what causes it.
Okay. Prolapse is very easy to explain. It's the connective tissue forms ligaments that holds the vagina and the uterus to the pelvis. Over time, those pelvic floor muscles start to relax, the ligaments start to relax, and the vagina starts heading toward the outside, and sometimes can actually prolapse out of the vagina. The biggest cause of prolapse, though, however, is childbirth. Multiple childbirth increases your risk dramatically. Diabetes, obesity, chronic cough, chronic constipation. There are several other factors that can cause this. Heavy lifting, people in jobs with lots of heavy lifting will sometimes have prolapse symptoms as well. The good news is that it's not uncommon to have it. 50% of women over the age of 50 will have some type of incontinence symptoms. By 80, 10% of women will have some type of incontinence surgery by the age of 80.
What is the difference between prolapse and incontinence?
Gotcha. Prolapse is when things start to relax and head toward the opening of the vagina. Incontinence is involuntary leaking of urine. And there are two types of incontinence, simply two types of incontinence. Stress incontinence that occurs when you cough, sneeze, leak, bear down. And then overactive bladder, which is when your bladder gets full, you get the urge to go, and sometimes you can't make it to the bathroom.
Okay, talk about the different treatments with prolapse and with the incontinence, please.
You can treat with biofeedback, Kegel exercises, other ways to do it, but it doesn't really fix it as well as it should be fixed. So what we're doing now is actually using mesh, and we're actually using mesh and placing it beneath the bladder and above the rectum, and securing and lifting our prolapse, repairing the prolapse so that the skin then grows into the mesh and it acts like native tissue then. In the old days, before mesh, we used to fix it with native tissue repair, which meant we just took the patient's own tissue and put it back together, trimmed some and put it back together. The problem with that was the failure rate was about 25 to 40%. And so when mesh came along in the early 2000s, mesh really changed the game as far as repairing prolapse. And the success rate with prolapse now with mesh is about 95%. Now incontinence you treat, it's a simple procedure as well. In the old days we used to do an old birch procedure, which we make a big incision. Now we do a little sling procedure, use a little bit of mesh underneath the bladder neck to repair that. And it takes about 10 minutes. You're out, it's outpatient surgery, you're driving in 3 days. So it's a much better procedure, and the success rate with both procedures are in the 95-96 percentile range.
Now let me ask you a question about these commercials you see about this transvaginal mesh. I mean, there's so many commercials where, oh, this stuff is so bad. If you've suffered any kind of illnesses, then people go to their doctors and they say, you need this mesh. So what do you say about those?
No question. I spend a lot of time talking about mesh in my practice because I still use it, and it's still the best way to repair our prolapse. The problem is everything that occurs with our old-fashioned repair, all the symptoms you have, pain with intercourse, difficulty urinating, pain with defecation, all those symptoms occur with native tissue repair. The only complication that occurs with mesh is actually the exposure of the mesh. The repair to fix that little small exposure, though, is very simple. They go home same day, very little sequela. The most important thing is that they don't have the prolapse again. You're not losing your prolapse. In the old days, you didn't count complication of prolapse as recurring prolapse. But with mesh, you don't have to worry about recurring prolapse. It doesn't recur. It's just important that you see a surgeon that has a lot of experience with mesh, and you'll be fine.
And obviously you do.
I do lots of mesh procedures. In fact, I was the first one to do a mesh sling procedure in Baldwin County. I was the first one to do a big prolapse mesh procedure back in 2005 with mesh. Or 2004, excuse me. So I've got a lot of experience with mesh.
All right, so if you have any more questions about mesh, if you have any questions about prolapse or incontinence, you can visit Dr. Shoemaker here at Thomas Hospital at Shoemaker OB/GYN.